Good afternoon to everyone in the land of Zoom, and welcome to the Board of Health virtual meeting on Thursday, July 14th, scheduled for 4 p.m. My name is Thomas Corey. Present with me via Zoom is Michael Coughlin. Dr. Stephen Gagliardi is going to be tardy today, and Tess Curran, our agent of the board. We are obviously not in the City Council hearing chamber. All are participating remotely from locations in the known universe. Pursuant to the open meeting law, any person may make an audio or video recording of this public meeting or may transmit the meeting through any medium. Attendees are therefore advised that such recordings or transmissions are being made, whether perceived or unperceived by those present, and are deemed acknowledged and permissible. Tess, can we have a roll call? I think you're on mute.
Sorry about that. Thomas Corey.
Present.
Michael Coughlin.
Present.
Okay, the next item is the approval of the minutes from the meeting of Thursday, June 16th, 2022. Are there any additions, deletions, or corrections to be made to the minutes of the meeting as printed?
Move to accept the minutes.
I'll second. Can we have a roll call?
Thomas Corey.
Yes.
Michael Coughlin.
Yes.
Okay, the next item is a hearing request of the City of Fall River Treasurer to revoke a food establishment license. At the request of the city earlier today, we received communication asking us to table that to the September meeting. Is there any objection?
No.
Can we make a motion on that to make it legal?
So moved.
Okay, I'll second. Tess?
Thomas Corey.
Yes?
Michael Coughlin.
Yes. Oh, sorry.
I don't know, Tom. You didn't answer for me. I don't know.
Okay, next item on the agenda is the preliminary public notification plan presentation by the Sewer Commission. Paul Furland is our guest and presenting today. Paul, if you would, welcome.
Welcome. Thank you very much, Board. Today I want to talk to you a little bit about a requirement for Mass DEP in the regulations, CMS 316 that we follow, 314 section 16. I do have a PowerPoint presentation that I'm going to put up on the screen. This requirement that was put into effect back in the beginning of 21 requires that we do public notification whenever one of our CSOs or is activated or we have an SSO. It's 314 CMR 16 is the Massachusetts regulatory code, and it has to do with CSOs, which combine sewer overflows, and then SSOs, which are sanitary sewer overflows. So just a little bit on the regulation. The regulation was originally signed into law back in January of 2021, and it took effect on July 6th, 2022. So by July 6th, 2022, there was a number of steps that we needed to take and put in place. We needed to have preliminary plans submitted to Mass DEP, both for CSO notifications and SSO notifications. Those plans were submitted to DEP. They were reviewed by DEP, and I have received approval notification from DEP for our current preliminary plans. Now, the preliminary plans is there's a number of steps that we took and implemented. We'll be moving forward with, and then within the next year, we're going to have to essentially come up with a finalized plan. So we're going to be able to tweak the preliminary plan, see what works for our community and surrounding neighbors, and then be able to move forward. So Mass DEP, these regulations came down from Mass DEP. So in regards to wastewater, the EPA has primacy in Massachusetts over wastewater standards. DEP can also set their own regulations in regards to wastewater standards, so certain things that we have to do. That's a little bit different on the drinking water side. On the drinking water side, Mass DEP has primacy And so they have regulations. They follow all of EPA's regulations, plus then also their own. But on the wastewater side, it's EPA that has primacy. DEP can make their own regulations and stipulations, which this is underneath the Massachusetts DEP regulations. What it's going to be requiring is event notifications. Whenever there's a CSO that's activated, so a combined sewer overflow, whenever there's a sanitary sewer overflow, or whenever there's a discharge of partially treated wastewater. And in a minute, I'll go through what those different things are, because most people know the term CSO, but nobody, they've heard CSO, but they don't know what an actual CSO is. So on the next slide here, it talks a little bit about a CSO and what a CSO is. So CSOs are pretty much only activated typically in wet weather. The city of Fall River, for years, we've been working to minimize the CSOs that we have. The actual definition: any discharge of untreated or partially treated wastewater to a surface water that is connected to a combined sewer. So there's two different pipes that go out when it rains. You have what's called a separated sanitary sewer stormwater system, or a stormwater system. Those two words are synonymous, and that means that if it rains, the rain falls onto the ground or goes into somebody's house, into their downspout, and is connected to a drain system. That water is all contained, just stormwater, so rainwater, and it can be discharged to a water body. There are regulations; those fall underneath the MS4 permit, another permit that we have to deal with. But that's essentially rainwater that falls on the ground and then just is conveyed out to a water body. A CSO is what's combined sewer overflow. So in Fall River, since we have such an old sewer system, a lot of the storm drains that you see on the side of the road, or the downspouts from houses or buildings, don't go into that separated, isolated system. They go into a system that is combined with the wastewater. So the house, you take your shower in your house, it goes down into a sanitary sewer wastewater system. In Fall River, about 85% of our city, all the rain also goes into that system. So the problem was, back when our system was built in the early 1800s, so our wastewater system, all the pipes went right down, they went right out to the bay. So whether it was a toilet flushing or stormwater coming down, all the pipes went right down out to the bay. In 1948, with the development of the Clean Water Act, you ended up having to build treatment plants. So that was in the late 40s, early 50s. Fall River built its first wastewater treatment plant down on the edge of Mount Hope Bay, and we built a large interceptor drain that conveys flow, follows the river essentially, and conveys flow from the whole entire city all the way down to our wastewater plant. That interceptor drain that was built in our wastewater plant couldn't handle the wet weather capacity. So when it rained, it couldn't handle all of that storm. So what happens, the pipes that went down out to the bay, they would put a dam on them. And under dry weather conditions, so when it's not raining out, just regular household sewage, and that's the picture here on the left during dry weather, the water just comes out of the building, out of the toilets, out of the showers, everywhere else, comes down and doesn't go over the dam, and then goes down to our wastewater treatment plant, gets treated, goes out to the bay. During wet weathers, so during rain events or other issues that we have, it overcomes the amount that can be taken by the treatment plant. So the stormwater and the regular sanitary sewer go into one pipe. A certain amount of it goes down to our wastewater treatment plant, is treated. A certain amount of it goes out and is discharged into water bodies. So again, this is just another picture kind of showing what happens. You have the house with a regular sanitary sewer, service from the house, goes into the pipe, goes into the lower interceptor drain, is conveyed down to the wastewater treatment plant. The right-hand side during wet weather, you have the sump pump from the house, you have the downspouts from the roof, you have the grates from the stormwater system in the street that all go into that same pipe. A certain portion of it is able to be conveyed to our wastewater plant, and a certain portion of it goes over that dam and out into the water body. So Fall River, as most people, some people know, we've been working to reduce the CSOs within the city. But again, that's a extremely large, extremely costly project that we've been working on for the past 30 years, and we still have a long way to go. But we've continued to work on it. Just a little bit about Fall River's system. It was developed over 150 years ago. We have over 300 miles of pipe in the city, about 240 of sanitary combined sewer, and about 60 miles of just stormwater pipes. Conveys dry weather and wet weather flows. Prior to 48, went straight down right out to the bay or into the Quikasham River. From 48 to 52 was the construction of the plant. So currently we still have 17 active CSOs within the city. Originally we had 19. 2 of them have been blocked off. We have 17 active ones. A number of those have been reduced or treated prior to being discharged from all the work on the CSO project that we've already done. So that's kind of the CSOs, combined sewer overflows, and that's one of the things. So there was 2 separate things that we're going to have to put notification out. Whenever a CSO, a combined sewer overflow, is activated, or whenever we have what's called an SSO, a sanitary sewer overflow. So that would be when you have actually a sewer pipe in the ground that comes up to the surface. So comes up to the street or something like that, and then can make its way overland, down and into some type of water body or puddle on the land. This typically happens whenever there's a break in a sewer main, a pump station failure, a blockage in a sewer main. These are pretty rare. Knock on wood, we maintain our system. We keep up with cleaning of our mains, inspection of our mains, maintaining, upgrading our pump stations. So knock on wood, these don't happen as often, but there is always still the potential for it to occur. And then the other thing that we talked about is partially treated or blended wastewater. That's really the other thing that we have. So, and this picture's sometimes a little bit tough to follow, but you have all of our wastewater goes down, goes into our interceptor drain, is then conveyed down to our wastewater treatment plant. At our wastewater treatment plant, we're able to handle up to 50 million gallons a day, primary and secondary flow. We can take up to 106 million gallons under wet weather conditions that goes through primary treatment and it's disinfected and then discharged. So it bypasses what's called secondary treatment, biological treatment. It bypasses that step, and it's just primary settling, screening, primary settling, disinfection, and then discharged out into the bay. That again typically only occurs under wet weather conditions, but that is another type of partially treated wastewater that could send contaminants out. Again, that only happens during wet weather conditions. The other 2 areas where we do have it, which could be considered partially treated, would be our President Ave pump station. So in Bicentennial Park, the building that's there, we have an underground facility that's 4 times the size of that building, where wastewater for that CSO, the wastewater goes in, is screened, disinfected, and then discharged And then on Cove Street at that pump station, we also have another wet weather CSO facility that again screens, disinfects, and then discharges out into the bay. So the wastewater treatment facility, again, right on the screen in front of you, takes up to 106 million gallons a day. Coming through it, there's two ways for wastewater to get into our facility. From the intercept drain, which comes from the right-hand side of the stream, comes kind of in where it says odor control facility. Right underneath that label, there's a pipe that comes in. And then the red line that goes through the center of the facility comes from our CSO tunnel that we have in the city. Within our wastewater treatment plant, our average flows are 26 to 29 million gallons a day in dry weather conditions. Again, we're able to take up to 50 million gallons a day on primary and secondary, and our full flow is 106 million gallons a day, which that would be primary and disinfection for the additional 56 million gallon a day. Our plant's on a very tight footprint, for a wastewater treatment facility of our size. It's a tight footprint with neighbors all around. Our staff does an excellent job with odor controls and mitigating other issues within the community. But it is a tight site. It is an old plant. Some of the original buildings are from 1948, upgrades in the 70s, 80s, and we're currently undergoing contract 2 of a large phased upgrade plan right now. A little bit about the CSO tunnels, and this is one of the things that really helped mitigate a lot of the CSO discharges out in the bay, anywhere in the city south of 195. This is a 20-foot diameter tunnel that runs under the city. It was bored through the granite, roughly about 100 feet below grade in most areas. Down by our wastewater treatment plant, right across the street, is actually where the terminus of the tunnel is. Just below grade. 3 miles long, runs pretty much up to Lowell Street, so almost where the DPW is. The street just before that, that's where the terminus of our tunnel is with our fan vault. We have 9 drop shafts that are strategically placed around the city and able to take flow, intercept flow in the sewer system. So during a dry weather condition, all the wastewater goes through, flows down to the edge of the bay, is put into the interceptor drain and conveyed down to our wastewater treatment plant. During wet weather, when it starts to rain, at each one of those drop shafts, we have gates that we can open and close. So we close the gate to the interceptor tunnel, and we open up the gate that conveys to the drop shaft and then down into the CSO tunnel. This takes all the stormwater and wastewater flow that's above those drop shaft areas and doesn't put it down into the interceptor, puts it into the tunnel. The storage capacity of 38 million gallons. So it's used to store the stormwater and also convey it down to our wastewater treatment plant. So it kind of has a double purpose. So during the wet weather, we're able to get that storage capacity of the tunnel, and then as the wet weather resides, it's able to convey itself down to the wastewater treatment plant and be treated, fully treated down at the plant. So this is one of the things that has greatly minimized the CSO activity in the south end of the city into Mount Hope Bay. But again, we still have CSO. We still have CSO activity throughout the city. The federal court order that we've been under since the mid 90s requires that our CSO activity, CSOs be active less than 4 times per year. This tunnel did a lot of work in working on many of those southern CSOs. President Ave Screening and Disinfection Facility took care of President Ave. Cove Street did Cove Street. We still have more that we have to do. Alton Street is one that's still active above the 3-month storm. The City Pier is still active. Birch Street. So there are still some other ones, whether it be in the south or the north area, that still need additional work. So each one of these CSOs, and this is a picture of what the actual CSO looks like and the dam looks like inside the pipe. Each one of these CSOs, we have a sensor in. We have a sensor that turns on a flow meter whenever it's activated. So there's 16 regulators, 16 manholes with regulators. They're all communicate back through cell services, and it goes back to a cloud-based site that we use. IUCA is the manufacturer and the provider of the cloud-based site that we're able to use. So in each one of these chambers, again, you have one sensor that trips it and says, okay, there's flow going over the weir in the CSO. And then there's another sensor, an ultrasonic sensor, that measures the level that's able, so that way we're able to measure how much volume is being discharged from the CSO. So this was one crucial part, getting all of these sensors in, one of the crucial parts in being able to do the notification that's required by the regulation. So this talks a little bit just about one of the alerts that we get from the IUCA platform whenever a CSO is activated. So this would be in Birch Street, status over the weir, the level, and the date and time. This is one of the key things that allows us to be able to do this notification procedure, because the notification that we're going to have to send out has a very specific list of requirements that need to be sent out, and then we monitor these all the time. So into the public notification requirements, we need to send it out either by email or by text. It needs to be within 2 hours of the discovery of an event. So we have 4 hours to discover an event, and then we need to send out the notification within 2 hours. This is Saturdays, Sundays, 2 o'clock in the morning. It doesn't make a difference. Our regulations say that it needs to be sent out within 2 hours. Each CSO that's activated needs to have its own independent notification sent out. So again, we have 17 active CSOs. That's 17 notifications. If all of them are activated, that would need to, during a storm, we would need to send out 16 notifications. One of the other requirements that we needed to do was set up a full interactive website for our CSOs, which includes a map, which includes CSO histories, current notifications, past notifications. On the screen, bottom right, you can see that a link to the, not a link, but the actual what the screenshot of the website looks like. So if you go on that website, you hover over one of those green dots, it'll tell you what CSO it is, whether it's active or when the last time it was active. The public advisory area, you can scroll through. We have past history, 3 years of CSO reports, activation reports on the website, as well as recent past notifications that have happened. So the website was another part of it, and then the warning signs. So the warning signs is a small one up in the right-hand corner, which we'll talk about in a minute, a little bit more. So one of the big things about the notification that was in the regulation too was to be able to reach out to our environmental justice community. We have to make sure that everybody involved, whether they're bilingual or whether they're single non-English language, is able to understand it. So our notifications go out in English, but then we also have available information on our website in different languages to be able to address the environmental justice communities areas within our community. That's all set by a map by DEP. What environmental justice dialects we need to use within our notifications. So the public notification requirement, again, within Discovery, it's a 2-hour requirement. It needs to be sent to state agencies, so we send it to the State Board of Health, DEP, EPA, so federal organizations, local agencies, so the local Board of Health will be getting these notifications. News organizations, we're required in the preliminary plan to put in a local news organization, so it'll be going to WSAR, the Herald News, as well as the Portuguese station and paper as well. And any other Board of Health that are affected by discharge, which we've designated those to be Tiverton, as well as Somerset. So we already have that all set up within our notification protocol. And those have been, we had one that was just prior to the 4th of July sent out a little prematurely as a test when we were setting up the system. But moving forward, there'll be notifications sent out. So it'll be 2 hours within activation, and then every 8 hours we need to do an update. So 8 hours from the initial notification, we need to send out another notification, either saying the CSO is still active or the CSO was terminated on this date and time. And then again, within 18 hours of that, there's also a DEP website that we need to provide all the information about the discharge to DEP, and that's within 18 hours of the close of the discharge. So it's kind of tough. Because I think Tess got the emails the first run. I know WSAR and the Herald News received them as well from the storm that was just before the 4th of July. I think it might have been on the 1st or the 30th of June. It was, a storm that activated our CSO's notification was sent out, and it's a slew of 16 notifications. I think it might have been 14 that went out for that storm, though. Notifications, so 14 emails sent to them. And we've sent out a press release from our office kind of explaining that this is the notifications that are required by DEP. And that there will be a number of them being sent out. The idea is to get this out to the public, because essentially when we have a CSO activation, it could be untreated or partially treated wastewater that's going into our bays or into our water bodies. So one of the things that DEP wanted to do with this regulation is be able to get that information out to the public when it's actually happening. So for these notifications, the other thing, anybody from the public can sign up for these notifications as well. So on the sewer webpage, there's a tab to be able to subscribe. Anybody can go in, subscribe. They send us their email. We're able to add them to the distribution list, and they'll get the notification whenever it's done. So some of the website requirements was a map of the outfalls, the public advisory that's put out for all the CSOs, 3 years of the CSO reports, which is on there, summary of the discharge, the past 3 years of discharge, CSO control plan, which we have in place, and notification subscription button. So if you go to the City of Fall River's website, you go to the sewer divisions page. On there's a CSO link. You can click on that, and then within that page there's a CSO notification. You can go to that spot, which will give you a link to this ArcGIS webpage, which is the platform that we're using. Or there's also the subscribe button there and some of our other information about CSOs. So the other thing that I mentioned was the signage requirement. And DEP's regulations said that we needed to post signage at all the public points of access, which in Fall River, we don't have a lot of public points of access to our waterfront. At all of our CSO locations, we currently have what you see that green sign there, City of Fall River, wet weather sewage discharge outfall, and they're all numbered. So we currently have those signs, and that meets the requirements of our NIPD's permit, and that's what's in place. The other sign is the sign off to the right there, that we're going to be posting. And that's for public points of access. So the public points of access that we've come up with for the city would be the Sandy Beach, far south down on Mount Hope, Atlantic Boulevard at the bottom of Mount Hope Ave. And then also we'll be posting one at the Bicentennial Boat Ramp. That's the other known public point of access. We'll probably be posting all these signs at each of our CSO discharges as well. So that way, if people do find themselves in that area, the warning is there next to the discharge point and next to our other CSO outfall signs. So that's something that we're still working with DEP to make sure that they're comfortable with the areas that we're going to be putting these in. See whether there's any other recommendations. So we laid out our plan within our preliminary plan, and we're going to I believe we put in there that we'd have these up by the end of September, I believe it was. So on this sign, it pretty much says, after a rainstorm, really you want to stay clear of this area. It has the sewer commissions, community utility sewer commissions contact information, as well as our website. It also has the Board of Health information on there, as well as the website. On the right hand side is just a warning, Department of Health, and saying that after wet weather events, there could be bacteria or other things within the water here. So just a little summary about the notifications. So on average, we have roughly about 250 to 300 CSO events annually. That's kind of what we run. Again, all depending on wet weather, how much wet weather we have. It really determines that. Notification, again, if anybody wants to subscribe for our notification, it's CSO notification account at fallriver.org. That's the email address. That's also the email address that will be sending out the distribution of the emails. Currently, we have a manual process set up. So one of our wastewater supervisors gets a notification from the IUCA platform, which is the sensitive platform that we use. Then that supervisor is responsible for taking those notifications and forwarding them out per this email. We're working right now with a company to get it a bit more automated. So there's two companies that we need to use to take the IUCA platform data, be able to put it into the proper public notification format, and then there'll be another software that we're using to be able to automatically distribute that. So we're working to automate this process a bit, but just working the bugs now on that automation process. But as of right now, we're prepared to meet the requirements within the regulations and move forward. That kind of runs through the current CSO notification plan. Again, I wanted to get to the Board of Health because you guys are partners with us in pretty much everything that we do. Specifically in the regulations that the Board of Health be involved within this process. That's why I wanted to be able to get this information to you guys, where we are, what we're doing moving forward, and where we plan to be in the end.
Okay, very good. I didn't realize how complicated it was.
Yeah, that's a tough thing. Everybody likes to turn the faucet on and flush their toilet, and that's where it ends. The thought process ends for them, and that's where it begins for us. So if anybody has any questions, feel free. If there's any more information that you would like, let me know. I expect that as we get this process a little bit more automated, We worked through some of the bugs and the growing pains that we'll be back to talk to this board if stuff changes. Things are always changing. DEP has been working with communities to make the rule, make the requirements where they work. Some things in their initial thought process and how things would roll out just wasn't going to work for any of the CSO communities. So DEP has been a good partner to be able to work through this as well.
I have a question for Paul in a different matter, not this. Where are we with fluoridation, Paul? Have you been able to restore that yet?
No, we have not been able to restore that. So there's actually it's a pretty rough time right now to try to get fluoride or any fluoride products. I'm a member of a couple of different water groups, and we're not the only community having this issue around the state. There's multiple communities having issues getting product. Our distributor, I just had staff contact them. I believe it was probably about 2 weeks ago, because Tess does ask me as well all the time. She's staying on top of it as well. And they're still unable to get product, and they have no determination. Actually, just recently, I know the DEP and also the State Board of Health sent out emails to most water departments asking about their status, because there are so many right now that are having troubles with acquiring the product that they need.
Yeah, the director of oral health did a presentation for all of the boards of health around the state and mentioned all of this. So I just wanted to know where you were on it.
Yeah.
Does the public know? Yeah. Does the public know there's no fluoride right now?
So I've talked about it. I've talked about it with you guys. Right. I know last time I think we were talking about it. Different subject. You also asked. Tess, I know, has reached out to all of her healthcare people in the community to make them aware. So I think that's kind of where it is right now. I've mentioned it at water board meetings. There's been discussion at city council as well. It is out there in the public. Again, it's not anything that we do want to hide. We want to make sure that people get the supplements that they need. And there are other ways, as you do well know, to be able to get it. For children, they can be prescribed drops or something or a supplement of that source. There are toothpaste that are higher in fluoride or other products that can be used to supplement.
I know. You don't need to.
Yeah, I know I'm just putting it out there for the public as well to let them know that they can supplement. Yeah.
All right, thank you, Paul.
Yeah, thank you, Paul.
No problem.
Just quickly on that note, I do know, again, to the point that the providers that we have notified, dental providers and pediatricians' offices, and those offices have indicated that they are supplementing, and we have received calls from area providers as well. Not only, we sent notification to the Fall River providers, but they have seemed to share that information with providers in other communities. So hopefully, any individual who's seeking dental care in Somerset or another community has also heard kind of through the grapevine about that, but we haven't done any public facing notification. Certainly if the board is interested, we can put something out.
If it goes on much longer, I think we should consider that.
Okay. I'm happy to draft something and we can make that notification. And I can also send a reminder notification to the providers in the meantime to let them know that we still haven't received the product, unfortunately.
Yeah, let me know. I think we can work together to test to do some type of joint press release.
Okay, thank you, Paul.
Thank you.
Thanks, Paul.
Okay, next test. Oh, Dr. Gavgard joined us. Welcome.
Hi.
We have the director's report.
Sure. So again, I just wanted to kind of give some more COVID updates. Fortunately, since we last met, the under 5 vaccines have been approved and are available in the community. As it stands right now, we have a recurring clinic on Wednesday evenings at the library from 3 p.m. to 7 p.m. That has under 5 vaccines available. Both the Moderna and the Pfizer vaccine are available at that clinic. And we'll also be adding additional opportunities throughout the summer. Health First, there's going to be a mobile provider at Health First on Saturdays that will also offer the under 5 vaccines. So right now, the state hasn't updated our dashboard to reflect the percentage of under 5 that have been vaccinated, but that should be, I'm told, updated tomorrow. Mike, you can feel free to chime in too if you have any additional information, but my understanding is we'll have more of an insight into who has been vaccinated in Fall River under 5 tomorrow. So the uptick does seem to be quite slow across the Commonwealth. And so I think we're going to have a lot of education to do. I'll be doing some media interviews tomorrow about the under 5 vaccines, and then we're going to be working on some kind of additional promotion with community members, and answering parent and guardian questions about the vaccine to try and again provide people with the correct information and make it easy for them to make the decision for their family. So that's been online for about 3 weeks now. And we're hopeful to have an increase because we really have seen very low numbers at the clinics that we've been having. But as it stands, 67% of again, this is over 5 because this is the state data as it stands right now. So the population over 5, 67% fully vaxxed, 75% have received a first dose. And we're also going to be really putting messaging out about the importance of people continuing to maintain their vaccine, being up to date with their vaccines, especially as we go into the cooler months and having people go back inside and all of that, just staying up to date. So continuing the messaging around that. And that's really kind of just the general update I wanted to share about that under 5. And we will have incentives available for those individuals as well as of right now. Our Friday and Saturday clinics at Market Basket, anybody who receives a first dose is eligible for a $100 gift card. Does anybody have any questions or thoughts?
Wasn't there something on out by the CDC about the home tests not being that great for the new Omicron variants or whatever they are, 4 and 5?
I haven't heard that. I know that, anecdotally, there were some people that had concerns with the at-home tests and throughout kind of the Omicron surge. I haven't heard anything specific to the new variants. I can certainly look into that, though.
Yeah, I have heard that. I mean, we know they're much more transmissible than the previous ones. But
Yeah, a lot more transmissible, but not necessarily worse.
Right.
And if you're
symptoms
as long as you're vaxxed, you're still good. But as you know, either way, as the numbers go up, even though you're still at a low percentage, your absolute numbers are going to go up for hospitalization. But people get that sense of security when they test at home. They think those are just as good as running in for a PCR, and so they're going to test at home. Look, I got a negative, and if it's not picking up that variant, they could be positive, and then just heading out and behaving normally, and then spread this more virulent strain more than it otherwise would be. So if they aren't as good for this strain, I think people need to know that a little more somehow.
I'll look into that again. I haven't heard that about the current tests. We do still have tests available at the library for folks to take advantage of. They're free, so people can go into the library and get some at-home test kits. I think the messaging continues to still be, if you've been exposed, be mindful of symptoms and tests, and then if you are symptomatic, to stay home even with a negative test. I think to your point, Dr. Gagliardi, some folks test negative even if they have symptoms, and then continue to go about their day, when really, if you are experiencing symptoms, you're supposed to be being mindful, staying home, and certainly wearing a mask when indoors. So I think I'll take a note of that and work on some messaging around that as well.
And I think the current Moderna vaccine has better coverage for these new Omicron strains. And one thing I read, if you were infected with the Omicron, with the big spike in January, you have a better chance of protection against these strains than people who were infected with the previous strain, because there were more changes in the spike protein with these mutations. So if they're Omicron, because these now are all Omicron variants that are taken over, and now 4 and 5 are becoming the dominant ones. So if you had Omicron in January, you're better protected, and the Moderna vaccine covers these Omicron strains better. Or, well, I don't know about compared to the other two, but.
And we are seeing, reinfections as well. So, I think that, those preventative measures to try and continue to encourage folks to, utilize and kind of fall back on, again, because there's so much we don't know, and the more information coming out about long COVID and multiple infections leaves you more at risk for long COVID. So, as we're still kind of learning and this continues to evolve, that, trying to prevent infection continues to be key for folks. And just one other note in regards to monkeypox, is that this state, does have a limited number of vaccines available for monkeypox, and that, if and when we see monkeypox here in Fall River, that would fall onto, in our lap in terms of the local health department managing those contacts. As it stands right now, my understanding is that the state has handled those cases and contacts, and that will likely be evolving to local boards of health. So, thus far we haven't seen any cases of monkeypox here in Fall River, but that would again fall to us, like any other communicable disease. It would fall to us at the local level. So, we'll be prepared for that should that happen.
Okay. Was there any citizens' input information received?
I did not receive any citizens' input.
Okay, we have to set the date for the next meeting. We're going to be going back to live. Hold on just a second. Eric, you need 23, 24, 25? Okay. How does August 18th sound?
Fine. I mean, we could leave the location tentative because, you know, as we
Well,
were
yes.
chatting, as we were chatting earlier, there's a strong possibility that the remote allowance will be extended. It just hasn't been made official yet.
I think I'm away on the 18th if we can do the 25th.
Okay, I'm not available on the 25th.
How about the 11th?
The 11th would be fine.
It's fine. It comes up pretty quickly. Do we have to meet in August?
You know, I don't know that, you know, that we have anything in the docket in terms of kind of things that weren't able to get ironed out before this meeting. So, in terms of licensing for Lisa or anybody upstairs. So I would say that there's certainly not a requirement that we meet. We could push it to September. If that works best for everybody's schedules. It is challenging with the summer holidays.
I mean, I'm available on August 11th. I just anticipating we might not have a lot
Have
of
anything,
business.
yes.
Yeah. It's only a couple of weeks from now, 3 weeks. So I'm comfortable waiting until September if you all are.
Well, if there's a crisis,
Right,
we'll have to,
right.
we'll
We can
have to
have an
confirm.
emergency meeting.
So if
Do you
we're
want
in
to pencil in the 11th and then we can cancel it if nothing comes up?
That's okay with me, yeah.
Sure.
August 11th. And for when we go to September, Labor Day is the 5th, so that would be a holiday week. You want to try for the 15th, maybe? Or you want to go back to the fourth Thursday of the month?
Yeah, we can go back to the 4th Thursday.
Fourth Thursday, the 22nd?
Sure.
And in the meantime, my office will just have to confirm that there's a space available here for us to meet in person since it's been so long. So if there's any conflicts, then we'll be in touch. Otherwise, we'll plan for that at the 4 o'clock time period.
All right, very good.
That works.
Can we have a motion to adjourn?
So moved.
Second.
Can we have a roll call?
Thomas Corey,
Yes?
Michael Coughlin,
Yes.
Stephen Gagliardi.
Yes.
All right, thank you all. Have a pleasant rest of the day and stay cool.
Okay.
All right. Take it easy.
Thank you.
Bye.